Goeienaand, baie welkom by Fokus. Ek is Lenet Francis Peuren. Bietjie later in die program hoor ons van die land se voorste voedselbestuur rolspelers wat onlangs vergader het om te praat oor voedselvermorsing. Die gebruik van Ivermectin is ingevolge hofbevel nou reeds vir 'n week lank wettig in Suid-Afrika. Dis hoofsaaklik 'n parasitiese middel, maar daar is diegene, ook medisyne, wat glo dit kan effektief gebruik word vir die behandeling van COVID-19. Na die onlangse Hooggeregshof uitspraak mag Ivermectin dus nou ook deur dokters voorgeskryf word aan COVID-19 pasiënte. Maar dit is 'n omstrede kwessie en daar is medisyne wat erg gekant is teen die gebruik daarvan vir corona. Fokus se Alet van Rensburg het via Zoom gepraat met dokter Naseeba Kathrada, wat deel was van die groep van 700 dokters wat in 'n brief aan die president die gebruik van Ivermectin bepleit het.
The court ruling has been a big victory for us, only because it now gives doctors access to get single-use Ivermectin, so on a per-script basis. So before, the only way we were allowed to get it was through a Section 21, which is the Compassionate Control Access Program. And as you know, that was a bit of a disaster, because if a doctor was seeing about 40 to 50 COVID patients a day, they would have to fill in 40 or 50 forms, and it takes about an hour to fill in a form. Now, just by scripting, normal script prescription, which you can send to a compounding pharmacy, a patient is able to get drugs almost immediately. And that for us was a big victory. What hasn't changed though is SABC hasn't changed their stance on saying that Ivermectin is now used for COVID-19, but then we don't mind that, because what they did in December was they banned the drug, remember, and they said that we are not allowed to use it, and they made it illegal. And now that we have access to it and it's easier access, it's a big victory for us, because we're very hopeful that more doctors are going to start using it and more people are going to stop using it from the black market. Then we can now start seeing the actual effect of Ivermectin and how good it really is.
Now, at the moment, can you prescribe it for treatment and as a prophylaxis, in other words, as a prevention?
Yes, 100%. Remember that when you're doing a script from a compounding pharmacy, it is at the discretion of the doctor. And that is exactly what I was fighting for. When I wrote my letter to the president, I said, dear Mr. President, give hope back to the people and give, I said, give hope back to the people and give control back to the doctors. So you must remember that when a person is got COVID, family members around them are helpless and they want to know what can they do. And they tried everything. So people say, take zinc, take vitamin C. Then somebody said, drink ginger. Somebody said, do this. You want to try everything, because at this point, we don't have a silver bullet. We don't know what it is that can be used for COVID. And how does it make you feel knowing that there is this drug out there that could have saved your family member? You don't know for certain, but the fact that you weren't allowed to even try it leaves you hopeless. Now that we are allowed to even add it on, I'm saying it gives hope back to the people. So a doctor can use it for prophylaxis, for mild to moderate treatment, and for severe treatment, and also in ICU. Now, when a person is in hospital, that was also becoming difficult, because you weren't allowed to take the Ivermectin into hospital. They were saying it was illegal, etc., etc. So now that second part comes in with the Section 21 Compassionate Control Access Program. You can do a bulk application for just 350 Rand. And an entire hospital can get bulk stock. So any doctor in the hospital can script on the patient's chart and get it from the hospital pharmacy for their patient in ICU or for a mild to moderate case in a hospital.
Is it easily accessible? I mean, is it easy to get it? Is it easy to ask a pharmacist to make it up? How easy is it?
Well, that's the thing now, right? So once we got the announcement, I sent a press release out, and in the press release, I said our work is now just beginning, because we now need to get the information across to people to say, this is how you get it, and this is how you're supposed to get it quickly. And if you look at the court order, the judge also instructed SABC that every 3 months, they have to come back to the judge telling him how quickly people are able to access it, what is the results, what are people getting with Ivermectin at the moment, are people seeing results. And he also said, if a person, a lay person or a doctor, is not able to easily get Ivermectin, like SABC now said it can be accessed, he's allowing that person to use the same case number and take SABC to court, because they can't just pay lip service and say, oh, you can use it, and then suddenly not make it accessible. So I found over the last week, I've been getting more and more people contacting me. So there are about 4 compounding pharmacists at the moment. They will get, so on a per script basis, you can get it from them. And then there are a lot of companies, so actually 3 specific ones that if you go to the Section 21 application site on SAPRA, they give you a list of people that can actually import the completed tablet. So that's the difference, right? So a boxed tablet in a blister pack comes from the Section 21 approved places by SAPRA. So Lamar, Equity Pharmaceuticals, and RX Medicals. Those 3 people have a Section 21 approval to import the drug in bulk. That's not the same as a compounding pharmacist. A compounding pharmacist has to bring in the API, which is the active pharmaceutical ingredient, and they make the tablets here in South Africa, and they compound it per script. So for now, we've got a few places where we can access it. I'm actually meeting with one of the big pharmaceutical companies tomorrow to try and get the word out to people. This is how you have to access it, and this is the quickest way for you. So if you come to me and say, I'm a GP, how can I get it? I'll say compounding. If you say I'm a dispensing GP or I'm a doctor in a hospital, I'll say Section 21. So I will be trying to get the word out, which is the best way and the quickest way to help the patients.
Maar daar is ook diegene wat waarsku teen Ivermectin. Bly ingeskakel, net hier navra ons dokter Kathrada oor onder meer moontlike neeweffekte. Ons is nou terug. Welkom terug. Ivermectin mag nou in Suid-Afrika deur dokters voorgeskryf word, ook vir die behandeling van COVID-19. Maar baie medisyne is ook gekant teen die gebruik van die middel, veral omdat behoorlike kliniese toetse nog nie gedoen is nie. In deel 2 van Alet van Rensburg se onderhoud verduidelik Dr. Naseeba Kathrada meer hieroor en oor haar persoonlike ondervinding met pasiënte.
There isn't a single drug that is coded for COVID-19. And when you look at the papers, SAPRA said that all the stories or what we're saying is anecdotal. I want to say to you, I've got a patient in front of me, and it happened to me yesterday. I had one of the drug reps who saw my name all over Ivermectin, and he said to me, he had COVID in January, and day 10, he took the vitamin C, he took vitamin D, he took everything. The doctor had put him on steroids. He was on antibiotics, and he was still feeling very bad at day 10, day 11, and then somebody told him about Ivermectin. So he took 3 good doses of Ivermectin, and he said that was the thing that made him better. Now, if I'm telling you the story about somebody I know firsthand who told me he swears by Ivermectin, that is not anecdotal. For me, that's factual. The man was sitting right here in front of me, telling me how Ivermectin made him better. And I hear those stories on a daily basis. It's unfortunate that we were not able to gather the stories and put it in our own study purely because SAPRA banned the drug. So if we were allowed to talk about it freely, and now that we are, I'm quite sure we're going to get more stories. There were these underground movements where were these Telegram chats and people were talking about it on WhatsApp, but it's not the same thing, you know. Now that people can say, I'm going to tell you, this is where I got it from, this is how much I took. We can start saying, oh, you know what, you actually got sick because you took 1 gram, you should have taken 2 grams. You know, we give you, we can start talking about it freely, and then we'll be able to give better decisions. And that's why I'm very hopeful that this decision has opened up a lot of doors for us.
Some doctors are very worried about possible side effects. They call possible liver damage. They even talk about blindness. Have you experienced anything like that?
Not at all. And also remember that because of social media, unfortunately, you know, sometimes reporters sensationalize things, and the way they write the headline is very misleading. And because we are bombarded with information all the time, I'm guilty of it as well. If somebody sends me an article, I read the headline, I don't necessarily read the article. And sometimes, like, because I'm very passionate about the Ivermectin issue, any Ivermectin article, I will read the entire thing. And when they talk about Ivermectin causing river blindness, the association came because Ivermectin was used to treat river blindness. It does not cause blindness. And it's been around for 37 years, and there must be people who've been taking it on a regular basis, and we haven't had any evidence of it being detrimental to a person's health or fatal.
Any of these other medicines that you've the doctors have been using over the past year in hospitals or to treat their patients, are any of them specifically, we know they're approved in South Africa, but are any of them specifically approved for COVID?
No, it's not approved. None of them are approved for COVID. And that's the reason why SAPRA sent out that tweet, because the SABC reporter, somebody said that SAPRA now approves ivermectin for COVID-19. That is not true. However, SAPRA should have, instead of just being rapping the person over the knuckle, they should have explained. It's a difficult concept to understand for general people, I mean, for doctors as well. So basically, all the drugs, vitamin C, vitamin D, melatonin, antibiotics, anti-inflammatory steroids, all of them are used for COVID-19, but not a single one of them is coded. So if you look at a package insert, it will not say for use in COVID-19. We know that it's being used because of its anti-inflammatory effects or its antibiotic effects or whatever. We are now using it because of what's going on around the world. It's the same thing with aspirin. So when a doctor gives a cardiac patient aspirin for blood thinning, if you look at the package insert, it does not say aspirin for cardiac patients. We give it to the patients off label, but it's something that's used regularly. So a patient doctor will just say to the patient, listen, I'm going to give you aspirin because you need it for blood thinning. But aspirin was not made as a blood thinner. It's the same thing with all the other drugs. Now with ivermectin, when SAPRA banned it, we weren't even allowed to try to use it for COVID-19. And still, the drug itself is not registered in South Africa. And you know why? Because it's very costly to register it. No company is going to put millions up just to register a drug. That's so cheap. I mean, at the moment, we can get it imported for 20 Rand plus VAT for 10 tablets. And it's a big difference between importing and compounding. So compounding is between 80 and 120 Rand. So that's the thing. It's such a cheap drug. It's actually cheaper to make a real ivermectin than to make a fake one. That's how cheap it is. So nobody's registering the drug. And if you look at the fact that the cream, remember the cilantro cream by Galderma was registered, and that's a 1% ivermectin cream, and that it has been registered for use in papular rosacea. So if you look at the package insert, it'll say this cream is used for a skin condition, no problem. If my doctor says to me, I think it's better for you to take the cream in a tablet form for your eczema, let me call the compounding pharmacy and say, make this up for this patient in a tablet form because the patient, something about the cream, fine. Because the API is registered, a compounding pharmacy can now make it into tablets. And I'll say, wait a minute, my patient, I want to use it for COVID-19 off label because the cream is now registered for eczema. They can make it into a tablet form because it's registered. I'm just going to use it off label for COVID-19. So ivermectin is not used on label for COVID-19, but then nothing is, like you just said. It's specifically off label use, but it now can be used. It's not illegal to use it. And that's the difference.
Why do you think that globally there's been such a reluctance almost to use ivermectin?
Well, if you look at it, if you're saying reluctance, there's specifically two sides, right? There's people who are pro-ivermectin and there are people who are against it. So like with anything, whether it comes to vaccines, whether it comes to an election, whether it comes to anything in the world, if you in a debate, you remember when we were young and we used to have debates and you weren't even allowed to choose your topic, but we had to learn how to research the pros and cons of the side that we have to take. It's the same thing that I see happening with ivermectin. So if you look at it, I am pro-choice. And I'm saying that you must have a choice to use ivermectin. It must be your choice to use the vaccine because I'm pro-life. And I think that each individual should choose what's best for them. And when it comes to making a decision like a treatment, the best person right now is a doctor. But the doctors need to get their information across the board from across the world and then make a decision based on that patient. But there are certain people who are against ivermectin and they don't give factual reasons for them being against it. But it's always these undertones of, oh, it's not safe, there isn't enough trials. So if you're saying that there isn't enough trials and it's not safe, then why don't you put your money where your mouth is and come and get 100 people and let's do a trial? No, you won't. Why? Because firstly, you're afraid that it's going to prove you wrong. And secondly, you need a lot of money to do a trial. We had a meeting literally last week. There were a group of doctors. We want to do a trial in South Africa. Do you know how much we were quoted to do a trial in South Africa via the correct channels? 21 million. I nearly fell off my chair. Who's going to give you 21 million Rand just to give a drug to like 600 people and say, you people take it once a week, you people take it 3 times a week, you people take it monthly, we're going to gather the data. You're going to go for ethics approval. Somebody has to pay for the drug. Somebody has to pay for administering the drug. And I'm like, 21 million Rand is a waste of money. that you don't need that much money to get the correct data. And then I started thinking, why do you need so much of money? Who's getting the money if you're getting ethics approval? Who's getting the money at the doctor? There's just a lot of money going to the wrong place. And literally it will cost about, seriously, 2 million rand, you can get the study done.
If doctors start using ivermectin now, more and more doctors, do you expect to see a drop in South Africa's COVID statistics?
Well, I'm going to answer that this way. You remember in December, SAPRA banned it on the 22nd. And you know there's no such thing as bad publicity. So the minute they banned it, more people started hearing about it, and suddenly our black market was flooded. And you remember towards the second, third week of January, we had a rapid decline. And nobody up till now can explain. I remember working 24/7 because I'm part of the home management team in Durban, and we give out concentrators, oximeters, thermometers, send nurses home. And suddenly we went from working 24/7 to literally nothing. It was such a drastic drop, and I started looking into it, and nobody can explain why the drastic drop. I'm not saying it was ivermectin, but I can't say that it was not.
En net hierna oor ons wat kundiges te sê het oor die voorkoming van voedselvermorsing. Bly ingeskakel. Meer as 10 miljoen ton kos beland jaarliks op vullishope in Suid-Afrika. Dit is onthul by 'n onlangse samekoms wat deur die internasionale organisasie WasteAid gereël is en deur die land se voorste voedselbestuurrolspelers bygewoon is. Hulle het na oplossings gekyk om in Suid-Afrika, waar miljoene honger ly, kosvermorsing te voorkom. Regisseur Adel van die Kerk het die verslag saamgestel.
'n derde van die 31 miljoen ton kos wat jaarliks in Suid-Afrika geproduseer word, land op in vullishope. Angela Ludik van WasteAid, 'n internasionale organisasie met 'n plaaslike kantoor in Johannesburg, sê die organisasie wil oplossings vind saam met ander rolspelers in die sektor om voedselsekuriteit in Suid-Afrika te skep.
Ideally in South Africa at the moment, the most critical starting point is your natural or organic waste, right? And so we were looking at food waste because unfortunately, the reality check is about 30% of food goes straight to landfill at the moment, which means that there are huge gaps in the market in accessing food that can be regenerated, that can be used to feed hungry tummies. But more importantly, when it comes to understanding the value of its natural resources and the natural resource being enriching our soil, the focus at the ground level of starting with organic or natural waste is so critical down the line of the value chain.
WasteAid het onlangs 'n byeenkoms in Midrand gehou met van die land se voorste voedselsekuriteitsrolspelers om oplossings te vind om te verhoed dat so baie kos vermors word en eerder by hongeres uitkom.
So the circular economy really is based on 3 principles. Anything in a design element needs to be redesigned from the start to go back into the system. Because on our linear scale of design at the moment, whatever is designed, we take, we use, and then we throw to waste, right? Take, make, waste society. So we're cutting that curve through really design thinking the process. Everything is about landfill avoidance, because the more we avoid in going back to our landfills, the more we realize the capacity of building our economy through the resource of waste management.
Compost Kitchen, 'n groeiende vennoot in die voedselvermorsingsbestuursektor, sê huishoudings vermors tussen 6 tot 8 kilogram kos elke jaar. Sowat 40% van die 10 miljoen ton vermorste kos bestaan uit vrugte en groente wat omgeskep kan word in voedingsryke kompos in steede daarvan om te lê en verrot op vullishope.
The Compost Kitchen is an organic waste recycling business based in Fokus, and we collect food waste from households and then we feed it to earthworms which eat it and then produce something called vermicompost, which is their feces. And that is extremely rich compost because it's got the biology that has come in the gut of the earthworm. And then we give that vermicompost back to customers at the end of the month so they can use it in their vegetable gardens again.
You'll see there's a little bit of spinach, there's some Hubbard squash underneath here.
Tydens COVID-19 inperkings in Suid-Afrika het die kosreddingsorganisasie NASH verskeie ton varsprodukte gered wat andersins vermors sou word en dit aan gemeenskapskombuise geskenk wat kos aan arm gemeenskappe voorsien het.
You see how colorful it is? I need the same for you.
Een van die gemeenskapskombuise behoort aan Suid-Afrika se vername chef Sitrim Khumalo, wat ook lid is van die organisasie Chefs with Compassion. Saam met studente by sy chefskool in Midrand het hulle duisende maaltye vir arm gemeenskappe in en rondom die omgewing voorsien.
Lately, obviously, with so much needs for COVID, the students have been involved in a lot of cooking for the community with the food that has been rescued through NOSH Foundation, that then comes to our foundation, which then CP School of Hospitality gets involved in cooking for the communities.
Rolspelers in die sektor meen Waste Aid se byeenkoms sal samewerkingsinisiatiewe versterk om die groeiende probleem van kosvermorsing in Suid-Afrika op te slaan.
Partnerships are very, very important in everything that you do. I believe there is absolutely nothing that you can do alone. Therefore, collaborations and partnerships and Waste Aid that came in today to participate in what we were doing. I'm moved. I'm moved with the partnership that has been formed and what we are going to do together. And I've learned a lot about composting, because one of the things that our students do, they do grow their own herbs and vegetables in the garden.
An event like this is very important because we are only good at a very specific thing, but we have customers that are requesting our services in different areas that we can't service because we don't know how to interact with them, or we can't reach them. So events like this allow us to connect with others who are doing similar work and are operating in different areas. And that way we can grow the businesses together and serve a greater need for society.
It is so critical for us to work collaboratively and through a network right now, because that is the only way. Time is not our friend when it comes to saving the environment and saving us as a human race on this earth at the moment. So networking, bringing people together, there's that moment of shared application and a reality check of saying we can do this together. I think through social distancing we've realized it's great and effective to work in isolation, and there's ideas of how we can collaborate, but it's in the coming together that this is established, cemented and then amplified.
En dit is al vir vanaand. Onthou Fokus word elke donderdagoggend om 10:30 op SABC 2 herhaal en ons is ook steeds beskikbaar op YouTube. Indien jy met ons kontak wil maak, besoek ons Facebookblad of jy kan vir ons e-pos stuur. Ons lees graag jou kommentaar, jou tweets en jou voorstelle. Stuur dit aan fokus@sabc.co.za. Bly op hoogte van al ons stories op ons Fokusblad op Facebook. Daardie adres is by Fokus SABC en jy kan ons ook volg op Twitter by Fokus ZA. Voorspoed vir die week wat voorlê en Ramadan Mubarak aan al ons moslim kykers. Tot volgende Woensdag aand om 7:00. Totsiens.